Hello, future pharmacists, and welcome again to Calculations Time with Dr. Dave. This lesson will be about sterile liquids. So in this one, the notion of sterile liquids is that we're dealing with products that they are in an environment in manufacturing where we're trying to prevent any microorganisms or foreign particles. So if you had to have something injected into your vein, you would certainly want it to be free of microorganisms as well as particulate matter. So the term for that is sterile. So the process in the way that it's made is what makes it a sterile liquid or sterile preparation that we make. Most of the time it is something that's given parenteral, which means it's given injection. Irrigation solutions are things that are washed over wounds. Inhalation solutions, so liquids that are inhaled into the lungs, in the nasal cavity, as well as things that go into the eye. For the most part, for this calculations, is most of the things will either be for the eye or a lot of them will be for parenteral, which means for injection. Something given usually by an IV. If you are going to put something in your eye, in your nose, or even your blood vessels, you have to make sure that the product will be isotonic with the biological fluids. And we'll discuss what that means and the purpose for that as well. All right. So the term that I was using is parenteral, and parenteral is a term that does describe the delivery of a medication, a nutrient, other substance that's going into the body by any route other than the gastrointestinal tract. So anything other than that, by taking something by mouth, and you can see the meaning. The common routes that we're going to be looking at are IV injections. So if you see something that's a question, it's asking for IV, it's being administered right into the vein usually. If it's intramuscular, it's an injection that's going deep into a muscle. Subcutaneous is something that's slightly under the skin into the lower levels of the skin. There are other routes here that are considered parenteral routes. We will not be needing that for this course, but you will eventually know what those all are. What the parenteral products that we make, so those products that we make sterile, they can come as ampules, which are glass vials that are cracked open. They can come in pre-filled syringes or multi-dose syringes. So these are pre-filled syringes. So an injected syringe that doesn't have a needle on the end, you put a needle on the end and it's ready to go. A lot of times they're in vials. So we have drugs that are either in a liquid form in a vial, and the drug will be taken out of that vial and injected, or there will be powder inside of that sterile vial, and sterile water will go in and reconstitute the drug to make it a liquid, and then we take that out with a needle, and that's when it'll be injected or given by an IV. We also, when we're doing IV solutions, a lot of times we're putting the medication into an IV bag. It can also be a glass container that's holding liquid. So we usually dilute the drug down and give them over a certain amount of time if they're not being typically injected directly into the body. So therefore, when we do have those small volumes, you can give it by the injection, but if it's a larger volume, it will usually require something to be slowly infused. So it's going to be given slowly into the patient, and that's usually done by an IV line through an IV bag. So the drug will be diluted, right, in a solution, in a base solution. Those base solutions are typically three things that are the most common. There's water, sugar and water almost, so dextrose. There's sodium chloride, which is salt and water. And another one, which you may see, is lactated ringers, which is a mixture of certain salts and is buffered a little bit. So the three things that we're looking at, the dextrose, the sodium chloride, and lactated ringers, they usually come in standard size bags. So these are just those liquids, anywhere from 25 all the way up to a 1 liter bag. And sometimes we just give those solutions to a patient, but a lot of times we'll also dilute drugs into those. So when there's a large amount of drug, or if there's a drug that needs to be slowly infused, we'll put some of that drug, let's say in 100 mLs or in a 1 liter, and administer it over time as an infusion, so a slow rate of infusion. If we do have to reconstitute sterile vials, remember I told you that's where we use sterile water, so we do use sterile water for injection. We can reconstitute a product and use that, but it's not given alone. These products are made in that you will typically be comfortable to give to a patient. If you give things that are like sterile water, they may start to burn, and we'll talk about why that is. But for this section, what is important to know in order to read prescriptions that do have it, you should know that D5W is dextrose 5% in water. That's D5W. That's the dextrose solution. Very common thing, D5W. The other one is normal saline, NS for normal saline. That is 0.9% of sodium chloride. That's 0.9% sodium chloride. That means there's 0.9 grams of sodium chloride in every 100 mLs of this solution. It's called normal saline. We'll see why 0.9% is a nice number. You can have a mixture of dextrose 5% and normal saline. When we do them together, we take away the little W there, so it's just D5NS. You can have half normal saline. So half of 0.9 is 0.45. That's why we say half NS. The lactated ringers is LR, and you can have lactated ringers even mixed with dextrose. You see the D5LR. This is the important thing to know. Just understand what those abbreviations are meaning. That this would be normal saline, and you know that's 0.9%. If it's at half normal saline, you know that would be 0.4%. Dextrose would be 5% dextrose, so that's 5 grams of dextrose in every 100 mLs. Sometimes, like I said, they usually don't put the W there. They might just have D5, but a lot of times when it's by itself, it's D5W. So what I was referring to before is that we sometimes will be administering drugs over a period of time. So the liquid is going to be slowly infused into an individual and not directly administered. The smallest thing is something called an IV push or an IV bolus. This is where you're giving a small amount of volume. This is like 1 to 3 mLs, and that's usually in a syringe, and you're slowly pushing that into a patient through an IV line. So the end of the IV line is the needle and syringe, and that's being pushed. And usually it's being pushed, as I said, usually greater than a minute over 5 minutes. So over about 1 to 4 minutes, 5 minutes, that 1 to 3 mLs is being pushed into the patient through the IV line into their vein. You can have something that's called a continuous infusion. This is something that's usually going to be a larger amount of volume. Usually you're going to see those D5NS, or sorry, the D5W, the NS, that's given, so the person is being given the IV for a long period of time. There's also intermittent infusions. Intermittent infusions is that, let's say somebody needs to get an antibiotic and it's about 100 mLs that the antibiotic was diluted in. You're going to give this 100 mLs over a short period of time, maybe like 1 hour, 30 minutes. This is going to be, again, by an IV line, and it will sometimes be connected to another IV line that the patient already has. And in that case, it's usually called an IV piggyback. Let me show you kind of what these products that I've been talking about are. So that ampule, like I said, is a sterile product. You would crack open this glass, and that's what would actually allow you to get to the drug. Sterile products. These are those pre-filled syringes. So there's a dose. This is a immunization product in this case. So the dose is here, and then a needle will be put on the end. So a needle would be put on here, and that's how the patient would get it. We also see so commercial liquids. So this is a liquid that's sterile, already reconstituted, already in a liquid form. Here we have an antibiotic that is in powdered form. So this is a powder. And the dose will be reconstituted with sterile water for injection. Sterile water for injection. That is going to be put into the container, reconstituted, and then it will then look like just the way the other ones do, right? All reconstituted. The IV bags that we typically see for injection, like I said, this is sodium chloride. So notice it's 0.9% sodium chloride, or NS. This is dextrose 5%, so D5W. These are different size bags. You'll see this is 1,000, this is 250. They do come in different, like I said, standard sizes. You see a mixture, D5 half NS over here, and you see lactated ringers again over here. This is where you would inject the drug into it. So let's say I had to dilute an antibiotic into this 250 mLs, I would take that antibiotic in a syringe and I would inject it here. It would mix into the IV bag. This is where it would go into the patient. So the patient would actually get the dose here. That's how they would get administered into it, by an IV line. So I can take a drug that I reconstituted here. I can take, let's say, 5 mLs out of this, and I can take that 5 mLs and put it right here, dilute it down, and then I can give this IV bag with the antibiotic over a certain time frame. Sometimes there's a spout on the front of it, sometimes on the bottom end, but then one part is where it's going to go into the patient itself. So this is us showing you that. So if you see here where the needle and syringe is, so this would be the antibiotic. I'm going to put it into that port. I'm going to dilute it down. You can see why it's a little bit yellow color. And this is where the IV would go into the patient. The patient's, sometimes it's an arm, sometimes it's in different spots on the body, but usually you'll see a needle that's going into the vein. This is the tubing, and you can see there's a syringe with a drug inside. The push is being pushed this way. So this is where we call it an IV push, because the person is physically pushing this medication slowly into the patient. It's usually not timed accurately, but it's a slow infusion, so it's pushed manually over a certain time. You can also see that this would be a large IV bag that would be a continuous infusion. So this would be set up where it's going into the patient. So this is where this would be. It would be like that, slowly going in the patient over time. So if the person's dehydrated, let's say, and they did need something, let's say like normal saline, you can give normal saline here continuously to the patient. And then let's say they have to get their antibiotic every 8 hours, you can put the antibiotic here, which is that intermittent infusion, and it could be piggybacked, and it's gone right into the patient. Now, the way that this is shown here, that it's going into the patient, there's this little chamber right here. This little chamber is what we have right here. It's called a drip chamber. And a drip chamber means that there's a certain number of drips that are going to happen. So this is a little drip of water, drip, drip, drip. It's going to drip down. These drips can be counted. So the number of drops, we call it. So the number of drops can be counted, and the number of drops will correspond to an amount of mLs. So if I wanted to give this patient right here, let's say 25 mLs in an hour, there's no way to measure mLs on this IV bag, right? But you can measure drops visually. So you can set the IV line to give you a certain number of drops. And you know that a certain number of drops will give you the 25 mLs, and you can do that over the hour. So we're going to do the calculations based on that. So when we talk about drip rates, this is the drip chamber. It's talking about the number of drops. So we're using drops as a way to take mLs where we can't measure it and turn it into something we can visually see as drops. All right. So that's why we do have those little tubing that we're going to be using, and we're going to be giving that in an IV line, where you'll see problems where you see drops that are being done. Right? The drop rates, right? The number of drops that will be falling that require 1 ml is what we usually see. So the IV lines were usually set so that they have a certain number of drops per ml. So if I said to you in a question that you're using an IV set that is 15 drops per ml, that means that this chamber right here, every time you see 15 drops, all those drops are going to equal 15 mLs. Right? There's sometimes you have drips that are 20, which means that they're tinier drops, and all those drops, 20 of them will give you 1 ml. So I'm sorry, I apologize. That's 15 drops, and this is 20 drops. This will equal 1 ml, and this will equal 1 ml. So how many drops will equal an ml is what we look at for the IV set. That's how we determine what those are. When we start to look at some examples, I think you get a little bit of clarity on that. So the IV set is usually determined by the drip rate in terms of its calibration. All right. So let's look at a calculation. At this one, it says, based on the following order, what would be the drip rate in mLs per hour? These types of questions usually are going to involve multiple steps of things that you learned. So let's first read what the medication order states. The medication order states that it's dopamine drip, so it's an IV drip. So it's a bag that has an IV tube and it's dripped. The bag has dopamine, which is the drug, 400 milligrams and 250 mLs of normal saline. So the drug is going to be an IV bag. Right? So you have an IV bag here. This is our IV bag. Right? This IV bag has 250 mLs, and inside of that IV bag is the drug. We've got 400 milligrams of dopamine. So that's the concentration, 450 milligrams of dopamine in 250 mLs. So that's the first part. And this is 250 mLs of D5W, as you see there. So it's D5W. All right. Now they want to infuse this. So now we have this as an IV line that's going to go into the patient. Right? So we have to administer this to the patient. This is going to be administered over a certain rate. That rate is given to us at 10 micrograms per kilogram per minute, meaning we're going to just be administering 10 micrograms of the drug per kilogram of the person's body weight per minute. When I see things like this, I usually try to immediately take this 10 micrograms per kilogram and convert it into something that I am familiar with, that makes it a little bit easier to understand. So I'm rewriting that. I see that the patient's weight is 152 pounds. We know immediately when we see pounds and we have to go to kilograms, we take the pounds, we divide it by 2.2, and we're going to get our kilograms. So if I was to take 152, divide that by 2.2, I'm going to get 69.09, right? 69.09 kg. That's the person's weight. So 69.09. I've got that. Now, with that in mind, I can take this dose right here and convert it into something that's a little bit more concrete. This says that we're going to just give the patient 10 micrograms for every kilogram. Well, how many milligrams or kilograms is that? So you're going to be giving 10 micrograms per every kilogram of the person's body weight. The person weighs 69.09 kg, right? So 10 micrograms per every 1 kilogram. The person weighs 69.09 kilograms. If I do the math right on that, 69.09 times 10, you're going to move the decimal, and we've got 690.9 micrograms of drug. Now, that's the amount of drug that we are going to be administering every minute. Now, because the dose of the drug is in milligrams, I'm going to do something quickly, and I'm going to just convert this into micrograms to milligrams. So if I use this into milligrams, I'm going to move the decimal point over 3, and this becomes 0.909 milligrams. So I'm rewriting this so that now this 10 micrograms per kilogram per minute, I can rewrite this as 0.6909 milligrams per minute. Now it's a little bit manageable for me to do because I'm going to have to eventually do that. And I'm showing you a stepwise approach to doing that. So that's the first thing, is to get the dose written. Now we have the question. We want to give the patient 0.6909 milligrams per minute. How much of this liquid right here, so how much of this liquid has to come out so that we have 0.6909 milligrams? Because that's what has to go over the minute. Meaning we've got 6909. Sorry, I mean it's a point. So I know that I need to give 0.6909 milligrams every minute. The question that this is asking us is they want the rate in mLs per hour. So how many mLs is this person going to get in an hour if every single minute we have to give that amount of milligrams? That's what the question is asking us. So this is the amount of milligrams you need per minute. If I've got 60 minutes in 1 hour, right here, I can tell you that I need 0.6909 milligrams in a minute times my 60, 41,454. 41,454 milligrams per hour. Getting closer. Notice I've got now milligrams per hour, but I need mLs per hour. So my last step would be to, okay, how do I take this milligrams and convert it into the mLs? The mLs meaning how many mLs here am I having? Well, we know that the drug dopamine, which is this bag here, the concentration of that dopamine is that you've got in a 250 ml bag, you've got 400 milligrams. If I need 41.454 milligrams, how many mLs is that? So there's 250 mLs contains the 400 times 41.454. I get 25 point, let's say 91. mLs. This is what E equals this. In 25.91 mLs, you're going to get 41.45 milligrams. So the answer right here is this, 25.49 milligrams, or mLs rather, per hour. This is the answer. Now, do you want to do it a different way? I did it stepwise to show you the thought process behind it. You could do this a little bit by the dimensional analysis in one straight shot. With dimensional analysis, you've got our line, our map here, and in the end, we want the mLs per hour. Right? That's what we're looking for, mLs per hour in our answer. Right? It's asking us. So we know mLs have to be on top, and we know time has to be on the bottom. So let's start with something. I would start with the things that we have, right? So let's start with the IV bag. The IV bag is 250 mLs of D5W and 400 milligrams. So the mLs, the liquid, has to go on top. So I know that there's 250 mLs of the drug has 400 milligrams of the dobutamine. I know that I need 0.690 milligrams. And I need that, right here, notice I need this dose, right, every minute. You write that a little clearer, 1 minute, right, over 1 minute. The question is going to be asking us in hours, so we know that there are 60 minutes in 1 hour. If we go back and we see if things cancel out, we've got minutes cancel out, we've got milligrams cancel out, we're left with mLs per hour. If you do the math out on this, you should come out with the same 25.901-ish, around there. All right, so the issue with these types of questions, usually people don't know where to begin. So try to think about what the question's asking and see if you can either do it by your dimensional analysis, if you like that, or break it up into pieces that make it simpler for you to do. So for example, change the dose in micrograms per kilogram. So if it's a dose based on weight, change it to an exact amount of milligrams. Now ask the question, what are they asking me? They're asking me the number of liquid that I'm going to be giving mLs. Well, this is the amount of milligrams per minute. I need to be able to change that to mLs, per hour. What do I need to do? I can change the the milligrams to mLs, and then I can change the minutes to hours, and that's what we're doing. Let's look at another example here. This question, what would be the rate? Now this is in drops per minute. So this is what they're asking us. They're asking us, and now we're looking for drops per minute instead of mLs per hour. It says you're using an administration set that's got 15 drops per ml. So that's like this. This drop set is here. Every 15 drops is going to equal 1 ml. So every time drop, 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 drop over here, it's going to be 15 mLs. Or sorry, 1 ml. So you have an IV set that's 15 drops per ml. And it says at this rate, how many minutes will it take to infuse 1 liter? So ultimately, we have 2 questions. One is what will be the rate in drops per minute? And the other one will be is how long will it take to infuse 1 liter of this continuous IV solution. So let's make sure we understand what the drug order states. It says start NS, so it's start normal saline. This is going to be a continuous infusion. It's going to be infused at, which is what this means, it's going to be infused at 125 mLs per hour. So every hour, the person is going to get 125 mLs. Now notice that we have to eventually get 125 mLs per hour. We have to go and make that into drops, right? Let me write that a little clearer for you. We got to get that into drops per minute, right? This is our goal. We want to convert 125 mLs per hour to drops per minute, right? So how do we take the mLs and convert that into drops? That's really the first story that we can do. And then the second thing would be to convert our minutes to hours. So if we take what's given to us, if we did this by dimensional analysis, right, I eventually want to be over here with drops per minute, right, equals. The first thing that I would do is take what I have. I know that I have 125 mLs per hour. Hours has to be on bottom because that's where the time is, and drops is what we're going to be mL. So I'm going to say 125 mLs is going to be infused over 1 hour. Let's see if we can get rid of the hour. We know that there is 1 hour. We've got 60 minutes, right? And with that, I have my hours cancel out and my minutes are matching. Now I got to get mLs to drops. How do I do that? Well, we know that in 1 ml, there's going to be 15 drops. How do I know that? That's what was told to me here. It told me by the IV set will give us that. So let's do the math out on that one. We've got 125 mLs per hour times, or should I say divided by my 60 and then times it by my 15. And I've got about 31.25. So we got about 31.25 drops per minute. Now, because 31.25 of a drop you can't do, usually you're going to round it to the closest drop. So in our case, it's going to be 31 drops per minute. That's the answer to the first question. We converted mLs per hour to drops per minute. Second thing that we're going to do is it asks us at this rate, so at 31 drops a minute, or at 125 mLs per hour, it's the same thing, right? Using that IV set. How many minutes will it take to infuse 1 liter? Well, I would do it 60 minutes, which is 1 hour, right? 60 minutes. We are going to infuse 125 mLs. How many minutes? If I am going to do 1,000 mLs. Why did I get 1,000 mLs? 1,000 mLs is 1 liter. I'm doing that naturally right off the fly. I'm converting things right quickly that I should be able to do fast. I should be able to do 60 minutes in an hour. I should be able to do the metric conversions from mLs and liters rapidly. Now that leaves me with an answer that's going to be in minutes, right? So if I've got 60 minutes is going to be 125 mLs times 1,000 mLs, we're going to be 480. So it will take me 480 minutes to infuse that. All right. You can also do this. This was dimensional analysis here. You can do it stepwise like I did before. You can convert stepwise. You can convert the 125 mLs per hour to 125 mLs per 60 minutes. That way you have the minutes done, and then you know that there's 15 drops per ml, and you can get the same answer. All right, let's look at another one. This one is for Versed. All right, for this Versed, it says that we've got an injection. It's available as vials, so we're talking about a drug vial. All right, so here's a drug vial. The label on it is going to say Versed. It's a brand name. It says 5 milligrams per ml. That's what we're looking at. And it says how many mLs of this. So how many mLs? I'm going to stick a needle in here. And I'm going to withdraw how much. I should draw it the other way. How much of this liquid do I need to take away out of this vial? All right, so my vial looks like this. Let me, if I can scroll down there. So my vial looks like this, let's say, right? How much of this liquid do I need to take out? So how much of the liquid do I need to take out to get this dose that says here? Now the dose is 0.05 milligrams per kilogram. Like I said, anytime I usually see a milligram per kilogram dosing for me, I immediately turn it into a dose. So I know that 187, red here, I know that 187 pounds divided by 2.2 is going to give me my kilograms. So immediately 187 divided by 2.2 is 85. So the person's weight is equal to 85, let's try that again, 85 kg. That's what it is. So got an 85 kg individual. Now we know that if you've got a dose that is 0.05 milligrams per kilogram, right? Every 1 kilogram, and the person weighs 85 kg, I now can tell you what the dose is. So the dose is going to be 4.25 milligrams. So this is saying 4.25 milligrams is going to be given IV stat. So it's intravenous stat. Stat means rapidly, right now. So in order to do the dosing, the question is, well, how much of this liquid do I need to take out to get 42.5 milligrams? Well, we know the concentration. Every ml has 5 milligrams. If I want 42.5 milligrams, what do I need to do? Or 4.25, sorry. Move my decimal over. I need 4.25 milligrams. It would not be good for the patient. 4.25, divide that by 5. We've got 0.85. Is the amount of mLs that I would take out of that vial and give by injection. But it also says, how might you recommend this? It would probably be by IV push because it's an immediate thing. We're going to push it right directly into the patient, not giving him an injection. So IV push is usually like that. Not something you need to know for calculations, but just an added step. All right. The next question that we have over here for these, a patient started a diltiazem drip at a rate of 11 milligrams per hour. The drip is prepared by adding 120 milligrams of diltiazem and 100 mLs of D5W. So let's first get a handle of what the question is setting us up. The question is setting us up for saying we have an IV bag. All right, so here's my IV bag. The IV bag is going to have 100 mLs of D5W, and inside of this IV bag, inside of here, is 120 milligrams of diltiazem. Dilt, I'll call it. So 120 milligrams is in 100 mLs of D5W. The patient's order is going to be 11 milligrams per hour. So we have to get this infused into a patient at 11 milligrams per hour. Now, we can't just do 11 milligrams per hour. We know we have to put some amount here, right? We have to be an ml or drops here. So this says, what would be the flow rate, right? The flow rate is going to be mLs, right? Per, we can say hour, or we can even do it per minute, however the question is asking us to answer it for us. We don't have to convert if we just do the hours. So again, we know that we've got a concentration of a drug and we're doing 11 milligrams per hour. It's a very simple setup where you have your concentration, right? The thing that I want is on top. I know that in 100 mLs, mLs is what I want, contains 120 milligrams of the dilt. Sorry for the skipping around there. Dilt. All right. If 120 milligrams contains 120 milligrams of 100 mLs contains 120 milligrams of dilt, how many mLs is it going to contain if I want 11 milligrams of dilt? So my answer here, 100 divided that by 120 times by 11, I'm going to get 9.16. 9.16, basically 7 mLs. Now, 9.167 mLs equals 11 milligrams, right? So all I'm saying is that I want this amount of mLs per hour. 9.167 mLs per hour. Or you can say 9.2 if you want to estimate it. 9.2 mLs per hour. And you're done. You can do a dimensional analysis as well. Set up your roadmap and do it. All right. I'm usually doing it this way so that I show you in steps and there's a little bit of thought behind it. And then once you're comfortable with that, doing the dimensional analysis usually works for people as well. Whatever you feel more comfortable with, that makes you understand the question as well as your answer. You want to be comfortable with your answer because one day in real life you will have to give the answer and your heart is going to be palpitating. You're going to be nervous to give it. So you want to make sure that you're comfortable now before that time comes. You want to be confident as well as having somebody else check it is ideal. All right, the next thing is calculations that are involving IV admixtures. These are the same thing where I was saying you take a drug or an additive. Here you can see you can take a drug, a vitamin, electrolytes, sometimes mineral multivitamins, and you're going to be putting them into an IV bag, right? A small or large IV bag. That's what we call an admixture. You're adding to the mixture almost. So not even knowing that, you can still answer the question over here. Let's look at this one. It says if you have diltiazem injection that is available as a vial 25 milligrams or 25 mLs, and there's 5 milligrams per ml. So here's my vial. It's got 25 mLs, and the concentration is 5 milligrams per ml of diltiazem. And it says if we wanted to make this IV that we was here, the drip, right? We wanted to put 120 milligrams in 100 mLs of D5W, right? How many mLs would we need? We want to put 120 milligrams in 100 mLs of D5W. This is the drug vial, right? This is the concentrated drug vial. How much of that do we need to take out and dilute into our IV bag? Well, again, you get your concentration, you put the thing you want. We're looking for, it says how many mLs. So we know that in 1 ml, I put the thing I have and the thing that I want on top. So the thing I have is a concentration, 25 milligrams per ml. The thing I want is mLs. So the ml goes on top, 5 milligrams. It's just like doing your ratios where you have this. Again, I'm just skipping this step, just doing it in one shot. So 1 milligram is 1 ml is 5 milligrams. How many mLs if I need 120 milligrams? So I would take 120, divide that by my 5, I would get 24, and my answer would be 24 mLs. That's how much I would remove from that vial and put into my IV bag. All right. All right. This next question is saying the same thing. It's saying that we are going to have a vial. So this here is the label on the vial. Right? This is my drug vial. The drug vial states the concentration of clindamycin is 150 milligrams, excuse me, 150 milligrams per ml. Also 600 milligrams per 4 mLs. No matter how they state it, it still comes out to 158 milligrams per ml. It says, how many mLs of the commercially available injection would we have to put into a bag of 500 mLs of D5W based on this dose? The dose is 20 milligrams per kilogram per day. Anytime I see a milligram or dose per kilogram, my immediate thought, let's change it right away to a dose. We know that we've got the patient, it's 12 pounds. We're going to divide that by 2.2. When I take, this is pounds, by the way, not, so I take 12 pounds. I divide that by 2.2. I get 5.45 kgs. I know that the dose is 20 milligrams per kilogram, so it's 20 milligrams of drug in every kilogram. The person weighs 5.45 kg. My dose is now going to be 5.45 times my 20, and I get 109. 109 milligrams. So now I've got this drug order saying 109 milligrams per day every 8 hours. So this is per day, and it's given IV over 8 hours. All right, so now because that this is the amount per day, right, and we're going to give it every 8 hours, this means that this is going to be divided into 3 doses. How do I know that? Every 8 hours, there's 3 8 hours in a day, right? There's 24 hours in a day, so if every 8 hours you got 3, so 3 doses is going to be given. So it's 8, 16, 24. So 3 doses. So this 109 is spread out into 3 doses. So if I take my 109, or my 109.0909, and I divide that by 3, I get my 3636. So this is approximately equal to 3606 per dose. I'm dividing this by 3 doses a day. All right? So that's how much I need per dose, because it says for one single intermittent dose. And I know my concentration. It's going to be 1 ml is 150 milligrams. How much do I need if I need that 3636? Oops, sorry. This is 3636. And this is 1.09. I think I kept the calculator there with the 09 in there. But we take 1 milligram per ml is 150 milligrams in that 1 ml. How many mLs if I need 36.36 milligrams? So 36.36, divide that by 150, we get 0.2424. So about 0.24 mLs is what we're going to need. This is how much we're going to take out of this vial for 1 dose. A few things to keep in mind. Make sure we always put the leading 0 for 0. The reason why this is a little challenging is because it has the word per day. The day means you take the dose that you get and you divide that into how many times that it's supposed to be given. So if it was 20 milligrams per kilogram per day given IV Q12 hours, you would have divided this by 2 doses. If it was just 1 time a day every 24 hours, you would keep it the same. Right? If every Q4 hours, you divide it by 6, right? So it's the dose you get divided by what they're asking you. So the dose per day means you always divide that out. All right. And that is the end for those infusions. So the infusions, you take a little bit of practice and get used to, not only doing the math for them, but also understanding what the question's asking, especially when you are being introduced to IVs and parenteral products and drips and things like that. So become familiar with that. Do your best. Definitely do some practice with them. All right. As always, this is the most important class because it's the only one that counts.